First off, I want to start by saying thank you everyone for attending my physician workflow session. My name is Donna. I'm going to take the time to show you some of the changes and enhancements in the physician workflow today. Our agenda would be to first look at our patient information bar. We currently have that within our charts now, but there are some additional quick links that have been added to the patient information bar. Then we're going to look through the SOAP. There's some hyperlinks as well as a new way to toggle and cycle our panels. We're going to touch on the care guidelines, which is a new area within the patient's chart right to the left now where we can just click on it and it's on every single tab. The all HPIs is in a new place now, which is great, as well as the vitals screen and something called the health promotion plan. That'll be something that is pretty new to us at this time, but I'm going to show you exactly what goes with that and how things are done. The assessment and plan, the view of that is kind of different in the way you access it. I'll show you a little bit about that as well as the finalized screen. So these are going to be a couple of things that are going to be changed in a sense to where you're viewing it different as well as how it's done. So I'll be just touching base on that. Not going to take very long. I won't take too much of your time, but we just wanted to make everybody familiar with how it looks now. So we're going to get started. We're going to jump into the patient's chart and show you a little bit. All right. Of course, initially when you come into a patient's chart, you want to make sure you are in the correct patient's chart. This patient here, we just opened it up, but normally you will come in and go into your inbox, double click on that patient, and view from there. Usually as a physician, you're going to come in and everything is pretty much worked up for you along the side. So you're just basically going to maybe run down to see exactly what it is that is the patient is here for. We, of course, always advise that everyone do what we call a 4-point check to make sure that you are in the correct patient's chart as well as within your location, and of course you as the provider will be at the top, but then you want to also make sure that you're on the correct encounter. Doing that will prevent from you going into someone else's encounter and documenting on. You would think that this probably should be done prior to you coming in, but we do have some situations where it does happen. So we just are very adamant about letting everybody know to do their 4-point check. The information bar is right at the top here. As you can see, is at a minimized status, but I can show you exactly how we can expand it and minimize it so you can see as much of the screen as you would like to see. There's a little drop-down tab, a little arrow here that you can click on to open it or expand it so you're able to see what it is that's within the bar. In here, of course, you still have your information about the hovering, where you're able to look at some of the medications, diagnosis, problems, or allergies just by a hover. I will tell you that with this, you can only see about 25 of them. So if a patient has 291, of course, you wouldn't be able to see them all. You have to actually go into the module. Here you can also see the patient status as far as MRN, what their insurance is on the chart level, as well as with whether or not the patient is in the portal. Now the new hyperlinks that I was talking about a little earlier, these are these things along the bottom here. Now you're able to open up the PHI log as well as appointments, demographics, the sticky note, referring provider, even advanced directives, and the screening summary. It depends upon what you want to see at that point that you are able to see. So these things are pretty much open and keeps you from having to maneuver away from the patient's chart to check something. You can do pretty much everything within the patient's chart. If you come over to the left-hand side as well, these 4 things here was something that was within the navigation bar before, but now they're along the sides. It starts with email, which at this point has not been connected, so you're pretty much using the same Outlook email that you're using currently. Your telephone call will launch the telephone call template, and the to-do, of course, will send a task out to your nurses. There's also something here, which is patient tracking. We aren't currently using that as well. We're going to be continuing to use the inbox to do the patient tracking because of the colors, and everyone's used to using that right now, so we're not going to change that. This is pretty much not linked to the same thing, so we're going to continue to use the inbox. So there's really only two of the things here that you'll probably use. That would be your telephone call and your tasking, and these are things that you can actually attach documents or templates to when you send out. All right, so we're going to jump into the patient's chart. There are some hyperlinks here as well, which are below the tabs. These things are an excellent way to have things on. Things such as the document library, if you need to maybe make a change to or make a note for the patient to go to work, or if you need to create some type of a medication list, you no longer have to come down here into the patient, your templates for that patient. You can actually do it along the side there and be able to see that information and do it without having to maneuver again away from the patient's chart. Order management, you're able to do your procedures. You can actually hit here and go to your procedures, or if a patient is a smoker and you need to do cessation for them, you can actually use the cessation button to do it as well. Moving right along, we're going to come over here to the care guidelines. The care guidelines are located to the left of every single tab, so you will always be able to look at the care guidelines. Within the care guidelines, if you were to click on there, you are able to look at the patient's current guidelines or protocols that they have opened. Or you can actually add in protocols from here. Within this particular pop-up, you're able to also use the toggle and cycle feature. This is something that is throughout the entire chart now, which is a great enhancement, I feel, because we have physicians who really don't want to scroll up and down the page. They'd rather just be able to click something and look at it, collapse it back, and be able to see what they have in front of them, as well as other things that are lower on the screen. So this is a great thing. So I'm going to show you how you would just click on this button and collapse everything, which brings everything to you. This is something that, again, is exciting for some of the physicians who are asking quite a bit about, is there some way we can do things without having to scroll up and down the screen? So if you look here, if you go into your care guidelines, this is just like anything else. You can actually add and update any of the protocols that are here. If you need to add in protocols, you can. If you need to possibly change the status of a protocol, if a patient has now had this test done that is due, then you're able to do that. You can just highlight it there. If there's a goal you have for the patient, you can put it there. If you possibly maybe have status, if it's been completed, you can update that status here, as well as complete the actions that was completed. It'll show you here when it was completed, and you just update it. From there, you will pretty much just come down and save at the bottom of that little screen. So it gives you a little bit of a scroll, but it's still, you know, better. Or if you want to come up to the very top to the right, you can save and close there. So that's pretty much how the care guidelines go, and it works the same exact way. And once you do complete it here, yes, it will complete and update within the patient's chart. Same thing with anything else. It's now able to work. So we're working on these things to try and get them as efficient and intuitive as possible. If you look at the cycle, that's something else that's actually used. You can actually cycle up what you want to see. So if there's things there that you want to see versus others that you don't really need, you're able to move them up on the screen. And with your login, you can click on how you want to see it, when you want to see it. So those are two features, the toggle and cycle, that are throughout, and I think that they're great things. All right, so our next thing would be, again, the toggle and cycle. Those two things, again, like I was saying before, as of right now, we currently see everything like this. So it's pretty much that you're scrolling down the screen or scrolling up the screen to be able to see things. So if you wanted to maybe see things without having to do that, you click on your toggle. This will bring all of your current things within your screen into like a collapsed setting, and you're able to look at those particular things as well as view the bottom of your page. If you maybe want to do medication for a patient now, or go into the procedures now, you don't have to scroll completely down the screen. If you forget to look at something, you got to scroll all the way back up. Now, if you were to get in and you needed to view something in your reason, you can just click here and it'll open up your reason for visit so you can see that. If you needed to check vitals, at the time of them getting their vitals and maybe you're about to do a procedure, then you would just grab a hold of your vitals, open it up, and view what the vitals are. So again, like I said before, it's a great feature. You're able to use this and do it according to how you want. If you possibly maybe wanted your physical exam to be first or your vitals to be viewed first, you can just click the cycle up and it'll just cycle up until you get to what you want to view when you first come within your screen, and that will be exactly what you'll see. So those features are great. I really, really like them. Now we're going to hop into what I call the all HPIs. Currently, the all HPIs was on the reason for visit outside portion above the additional manage. It was here currently. And then sometimes when you use them, there were, some issues where you would save out of them and they wouldn't come over. So at this present time, this should be something that works properly. You won't have to worry about, it not working the way you want. Once you save and close out of this additional and manage screen, it should populate over here. So let's go into it. I'll show you now. All right, with the additional and managed screen, it's the same. The vision of it is the same, how you see it. As you can see to the right, of course, you have still up to six things you can actually put in for a patient. So you're able to do that without having to worry if there is enough for you to be able to see. Everything is here. You are able to see it, and you're able to use this according to how we currently use it. But what I will say is if you're in your select reason for visits and there's something you don't see within here, what you would do is come up to the top and check all HPIs, and it will generate the entire all HPIs to show on that select your reasons for visit as well. So if you came in and this patient, let's say, patient came in and they had chest pain. So what we did is say it's possibly something that has to do with cardiology. You can click on that there. It will bring it over into the section for the reason for visit. You can click on save and close, and it'll bring it over into your actual history of present illness status. When coming here, you're able to click on it and now go through the procedures of how you would select where things are. So you can go through that same procedure, click accept, and you're done. So with that, again, you're able to now, it's going to pull into your particular screen. You can see it in front of you. You don't have to worry about, oh my God, where did it go to? I just filled it all out. I can't find it. Well, now it's here. So that new feature I think is very awesome. It works very well. You can at this point, if you want to leave it checked so you can view through all of them each time you can under your login, or you can just uncheck it and you can use it as needed. So once you've done that, there you have it. The all HPIs, again, works much better now. It's within the reason for visit additional manage, and you're able to access it without having to go to a whole nother screen, another pop-up. Everything pops over like it should, so it's pretty much usable now. All right. Another thing about here within the screen, if you run out of space within your reason for visit, you are actually able to click on comments, and you can open that up and add in more information inside of this screen as well. So you have additional area to be able to type up if you have more to say than what is allowed, which inside of the HPI sometimes is only a tiny space, but you have more space to use. You also have your My Phrases and Manage My Phrases to be able to add in new phrases if you need to and use your current ones that you have. So this feature is pretty good. It works really well. There's also an area here called Show All. So if you wanted to view exactly what the chief complaints were that you have, it'll show you all of what you currently have as chief complaints. There is an area where you should be able to, if you need to add some things in, at that point you can also add some additional information within the system if you needed to add more information in. And then save and close out of the screen, and whatever you've written will still stay within the reason for visits that you've chosen. Okay, We're going to collapse this back. Now what we're going to do is move down to your vitals, or up rather. When you come into the vitals, the initial view is the same exact thing. It is still your vital screen. You're still able to go in and clear for add, and maybe if you need to do a second vital for blood pressure, or maybe they had tachycardia or something like that, you're able to go back in and do those things if necessary. So if you wanted to add in something, I'm going to show you the new screen that you're going to see. The nurses also will see this, so they're not confused or thrown back when they see the actual screen. When you open up the vitals, it is now a new setting. It actually works a lot better. It flows across the screen as we were doing before, but everything's all in one. The hooray part about this vital signs is the fact that your BMIs do work now. They do properly calculate. So we no longer have to worry about it being an incorrect calculation. The measured today and carry forward information, correct now. So it works. So it's something that we've been really hoping and waiting for, to make sure that these things work for everyone, so that they're not feeling like, God, I want to make sure that this patient, I'm not giving them the incorrect stuff. I want to be sure that how I'm calculating this is correct. It does work now. So that works even better. I'm excited about that. Hopefully we all are. There's also a comments box here. If you need to add in some information for the vitals, you're able to put that information at the bottom of the comments. And the audiometry as well as the vision screening are still within the screen, so you're able to still use this. All right, so that's pretty much it with the vital screen. It looks different, a little more cleaner. It's not as congested and, trying to figure out where you should go and what you should do. It's kind of left to right on the page as we would want it to be. All right, now as we come to the outside, there is something called the Health Promotion Plan. We're going to click on that, and I'll just tell you a little bit about it. We won't spend too much time here. The Health Promotion Plan, what it does is, if a patient has something that is out of range, could be your BMI or hypertension or something outside of what needs to be done, or for that patient, or outside of what their normal things should be, then you're able to create a plan for them. Now, this particular thing does help a lot when it comes to putting together something and you, as a physician, getting some credit for it. It's a new requirement for Meaningful Use Stage 2 and some of the PQRS stages as well. There's things such as the BMI hypertension plans, as well as fall risk, pain management, and functional status. Within it, if there is the link in there or the BMI are out of range, it would show that the patient should, the template should launch. You would be able to choose which plan, and you put your information in as you do it. So I'll show you what I mean. Say if it's a patient who had a hypertension, something along the lines with blood pressure was maybe 140 over 100. All right, you would choose like the diagnosis from this. So if currently they don't have one in, what it does is it pulls in the actual diagnosis codes as you choose the plan. So if it was maybe heart disease, you could put it here. If it was a hypertension chronic, not a kidney disease or something, you could put that in it. Or if it's just your plain essential hypertension, the 4011, you could actually just choose which one you wanted to do. And it'll pull your code in and everything. If you wanted to choose a diet plan, you choose a diet for them. Maybe there was some type of a regimen that you wanted to have them on. Let's see here. Let's see. I'll just choose one of them. It doesn't matter. Just maybe you're just educating them on managing what they do and how they eat. So we're just going to put that in there. You can add in if you want them to possibly walk a mile, or some type of strength training or encouragement, just general encouragement for exercise or recommendation, you can choose that. Same thing if you wanted to do a referral or some other type of lifestyle. And what you would do once you've done that is click on Add. That will drop down into this box here. Now, if you needed to update any information, you could actually click on it and update it as follows. But this is just kind of like an overview of what will be done within here. And like I said earlier, you also have pain management, fall risk, and functional status for other patients that you could use this for. Within or throughout the entire patient's chart, you're going to also see these cues with star. These are items that provide regulatory compliance aspects of anything within the chart that will satisfy like your meaningful use measure. This is for both you and your staff. They can all view it and see exactly what is needed to meet those particular standards. It will let you know what is needed to get credit, and it also, some of the things now have been picked. You have to actually pick out of the pick list, and it's not something you can free text. So these things will actually have to be chosen for you to get credit for. So the Q codes are very important. It'll kind of give you like an overview if you were to click on them. It just says how you perform or do the percentages for particular patients. It'll give you kind of like, again, some standardized tools for that. So the Q codes, again, you will see throughout the entire patient's chart. And you can just, if you want to generally look at them and see exactly what it's about, you can. So that's pretty much the health promotion plan and how that works. But again, it gives you credit for both meaningful use and as well as PQRS. All right, and the next thing we're going to do, I'm going to show you within the physical exam. I'm not going to pretty much get into it too much. I didn't really. If you were going to actually put some information within the one-page exam, and currently we use this as well here, and say maybe use a default within the system. It's a female, so I'll just grab something else because this is a female I have. I'll just use a general female. All right, so these things will be marked within the system, and this will pull up your physical exam. This is what you wanted to do. Right now, currently, you can actually highlight one, and it'll just, you're able to remove it if you need to or if necessary. Within here, when you click within this grid, it's going to just populate back the entire page that you pulled up. But if you wanted to make particular changes to a specific system, you actually will want to actually choose from the side here. So if it's something I wanted to grab from the nose, mouth, and throat, I could just choose that area, the nose, mouth, and throat, along the side, and come in and create the changes I wanted to create and save and close it from here. But I wanted to show you that because I wanted everyone to see how it's working, and you're not frustrated with the fact that it's populating back into a big area when you just wanted to see something as small as this one section of it. So that's how you would do that for the physical exam. I just wanted to throw that in there really quick. All right, so now we're going to move on to the assessment and plan, which is the big portion of what we do here. The assessment and plan now, when you choose the assessments, you don't have to come down and go to add an update. You can actually just populate right over here and go to your assessments and open it up. With the assessments at this point, the screen again is a little different. This is something that the physician who came or who spoke with us about a month or two ago, he expressed, a little bit about these areas within here, and also about the AMP or assessment and plan details. He showed those as well. So within here now, what you have is still 5 different areas where you're able to choose any diagnosis from. You can choose it from here with your billing diagnosis as well as your clinical problems. If you have favorites saved, you can use your favorites, or if you have maybe common assessment or diagnosis code lookup, you can use those. The diagnosis code lookup is what we currently use now, which is our search engine. That search engine is far in between special. Excuse me. I like it a lot because now it's easier to use. You can actually stick the code right in the little area where you put in your, type your words in without having to choose this or pick that. It's so much more easier to use now. And it's really a great tool for us. If you at some point needed to possibly maybe use the common assessments, they are still accessible as well. You can just go right in, look through your common assessments, and choose which one you would like to use. And this is, again, with the darkened areas. Of course, you know, or we all know that there are additional things when it's a darkened blue. All right. Now, in order to use like your billing diagnosis or even your clinical diagnosis, you can actually, you have to come up and click where it says Add Assessments on one click. Excuse me. And then once you've chosen that, you can look through here and see if there is something particular that's used or something that the patient has previously had that you can just click on and it'll drop it down for you. All right, once it's dropped down, if it is not, like say if you've chosen it from somewhere else, like here, the diagnosis code lookup, and you don't have it here within your clinical problems, what you'll have to do is highlight it. If it's something that's not just billable, if it's an actual problem and it's not just a billable thing, then, you know, like maybe urinate frequency or something like that that you're just billing for. But if it's an actual diagnosis problem that the patient has, you would highlight it and you would click here and update that information to make it a clinical problem. If you needed to specify more information, you could very well and do that. If there's a small impression you want to put in or even a differential diagnosis, you can actually add that as well. But once you've done that, you click on Add and Update, and it will add in that particular diagnosis to the clinical problems now. All right, I'm waiting for this to load. Sorry about that. Should be coming up shortly. All right, great. So now, as you can see, here we have made it a clinical problem as well. So it's showing you that this is a clinical issue that the patient currently has within their chart. And from there, you can go ahead on and move over to your A&P details if you need to. All right, within your assessment and plan details, when it comes over, it's going to bring up this particular screen. Now, in order for you to make any changes or to do any impressions or patient or plan details, you're going to have to now highlight what you're going to be doing it for. So it's no longer these strips that have things already set up for you. You actually have to highlight it and then begin your impressions if you do them, if there's a differential diagnosis that you want to do. Or if you want to just get started with your plan details, you can just go in and type what it is you want to have for the plan details. Any additional information just for your view that will not print on the patient plan, you would actually put it here. So it's a little different now. We all, I think, seen this a couple months ago when we saw Dr. Allen, who was from NextGen, who came in and showed us a little bit about this, but you're able to use those particular 4 boxes for how you want. You just know that the provider details will not print on the patient plan. It actually goes to your master IM basically, but the patient detail does. So this will print on their particular details patient plan. The My Phrases, Common Phrases, and Manage My Phrases, again, come over, so you will have the option to use those if you have some saved. And then again, if you look here, you have another Q code there. So you're able to look in there to see exactly what meets the expectations of certain criteria within there while you're within this patient's chart finishing up. If there's anything that you want to order for labs, diagnostics, or even referrals or procedures, you can go right across the top and do those. If not, you pretty much just save and close out of this, and it'll drop down into the screen as it would and did before. So those things are particular, it brings here. Above earlier when we were talking about the health promotion plan, there's also an area here where you can just grab it from your assessments box, and you're able to do it currently. All right. Okay. Now pretty much we're nearing the end, and it pulls into where we're going to be grabbing the finalized screen. The finalized screen, if you need to do something prior to that, you can hit on the medications, or if there's procedures that you need to do, you can do those. If not, then you can jump on over to your E&M coding. All right, so this is going to bring up your E&M coding screen. Now there isn't much that changed here within this, not at all. Again, this does also have the toggle and cycle panels, where if you wanted to close or open them up, you do have that option to do so on here as well. It opens here where you can see the actual assessment, or today's assessment that was done. That information is within it. And let's see, if you come down a little further here, your provider sign-offs. I know before there was where you had to be able to sign off for if you had mid-levels within your office. As a physician, you have to sign off on anything they do, especially Medicare stuff. So instead of it being on the bottom left-hand corner, it's now at the very top. So you're able to just, as soon as you go in, sign off on it and move forward with it. You don't have to scroll down that much anymore. And now you do have, again, the feature to toggle and cycle, so you're able to do that. Your medical decision making, same thing. You're able to view the risk table if you need to, or MDM guidelines if necessary. Your counseling is in the same area. For the management or calculating of your code, there's a CQM check here. If you needed to look at that, you click on Calculate Code. Only difference in this area is everything that you were using before that was basically on the left-hand side here is across the top over here on the right, which is in the other areas where there are some codes there. You still do have the same option if you want to possibly just not use the 212 or the 202 that's given you, and you feel like you have enough information to upcode on it, you are able to still select your code. So that hasn't changed at all. That hasn't changed whatsoever. So you're still able to change the code if you need to. With the Medicare preventative codes, there's also a CQM here. So you're able to view and see exactly what it is that will give you the credit for it. Again, like I said, the Q codes are everywhere within the system, so you're able to view that. Now, if you're getting a code that you feel like, you know what, I really and truly feel like I should have gotten it better, you're still able to come to the bottom here and view exactly what your summary was, what it was that calculated the code that you have. So that information is here at the very bottom. There are some other things at the bottom too, but nothing that I believe that we use as much, like dermatology, behavioral health for some of the physicians who do that. That is at the bottom as well. All right, so pretty much with that being said, this is basically the rundown of currently like the physician workflow and things that have pretty much changed. But everything else is the same. We are still using the same templates. Basically, you know, there's a little bit of an upgrade or a better area to set forth. We do have the toggle and cycle, which is a brand new great feature. And I hope you all enjoy these things because it's a lot easier and simpler than what it was before. A little bit more intuitive than what it was as well. And you're able to get into your patient's chart and get things done a little quicker, hopefully. So this pretty much concludes my physician workflow. I want to thank everyone for attending this session. So that is it, and I hope you all have a wonderful, wonderful weekend and day. Thank you.